Torque release is actually a technique that is basically not really a technique, but a protocol. So a step-by-step sequence of events that we follow on the spine to make the corrections in a specific order and in a specific way. The torque comes from the pressure that's on the vertebrae, and the vertebrae is three-dimensional and it moves in two planes. And so if it misaligns to the right, we make the correction. But if it not only does it move to the right, but it also pivots on its axis, and that's where the torquing comes. And so with the technology that we use, it counteracts that pivot. Okay, very good. Okay, so in the spine, there's two types of bones. Both have the function of protecting the nervous system. So we have two types of bones that protect and house the nervous system. So let's just say that this is your spinal cord. That's one type, and then the other type is very similar, only it's anchored to the bone. Now, if this bone here comes out of alignment, it doesn't really distort the spine. It just makes it that if it slips out of position, and then we can just go in and put a force in and make it go back to where it came from. The second type of bone, because of this attachment, if this bone now moves out of alignment, it's going to distort the nervous system also because of this attachment there. Okay, so in this second type, the bone still protects the nervous system, only the difference in this case is that it's anchored to the nervous system. So if this bone misaligns, it's going to distort the nervous system also. And if we try to apply a force, a manual force, back this way, it's also going to re-aggravate the nervous system, and we don't want to do that. To bypass this distortion or this increased aggravation on the spinal nervous system, we use a tool, an instrument that just delivers a vibration into the bone, and it's picked up by the nervous system, your brain, and then the brain will move this bone for us under your own power, even as you walk out of here. Okay, so this is the Integrator. This is the tool, the technology that we use in torque release technique. And what makes this tool so special is that it has two forces on it that can be applied at the same time to the bones in our model here. In this type of bone, there's a special connection between the bone and the nervous system through these connections. And on this type of bone, it's just a bone that protects the nervous system. So to make the correction, we apply a force into the bone here with the tool, with the Integrator, and it can do one of two things. One, it can just apply force directly to the bone, and secondly, it can also apply a torque, a twisting to the right or to the left.